Some of you have been to my presentation before on the fall prevention, and today we're going to be doing it on pelvic health physiotherapy. Who has gone to pelvic health physiotherapy before or heard of pelvic health physiotherapy? No one. Woo! Okay, you're going to learn so much. That's good. That means you're going to learn lots of info, lots of new info. You can take probably half of it in. But there's going to be a lot of info today, but I'm going to send, or I'll send, I've already sent the presentation to Samantha, and then you can all take a look through it afterwards. I think she has your emails, everyone's emails? Perfect. Because at the end, hi. I am. And yeah, at the end, there's some resources on there, and there's some links to videos. So if you want to practice any of the exercises we do today, or if you want to listen to any of the information videos, there's a bunch of resources at the end that you can click on the link to it.
And probably not for another week or two, but we will eventually be putting this up on our YouTube, so you can watch it whenever you'd like.
Yay! Okay. So this is what we're going to be talking about today. I'm just going to kind of go through this slide super quick, and then you guys can use this as a reference to go through the rest of the slideshow. So some of you already know me, but just a little bit about me. I am from St. John, New Brunswick. My name is Jalisa, by the way. I don't think I introduced myself. My name is Jalisa. I'm a physiotherapist. I work at Synergy Physio-Pilates as I work in pelvic health, but I also treat sports injuries, orthopedic injuries, and my approach to care is more of an active approach. So I'm all about exercise and educating my patients. And I went to Dalhousie University for my undergrad, and then I did my master's at McGill University. And I've been living I lived in a couple different places: St. John, Qatar, Oman, Montreal, and now back to Halifax again. And my parents just recently, pardon? And you still look like a teenager. I know. I'm 30. The big 30 this year. Yeah, and my parents just moved here, and they haven't lived in Canada for 17 years. So yeah, I'm really happy and excited. They moved to Mahone Bay, and I also am in the middle of a move right now, so life is, but now things are settling because move is done, thank God. But I'm hopefully done moving for a while. What else? My personal interests, I used to be a competitive swimmer. I love to hike, and I love spending time with my family and friends, and my adorable cat named Tuna. She has to make every single one of my slideshows. And these are my parents right there, my mom and dad. And I'm an only child, so I'm very close with my parents and my cat. Oh, and this is in Spain. My parents actually moved from Spain, so we loved hiking in Spain. Okay, get into the nitty-gritty now. So our pelvic floor muscles are a group of muscles. There's 3 layers of these muscles, and they sit in the bottom of our pelvis. So between our tailbone, so right here, to our sit bones. So their sit bones are on either side here, and then the front of our pubic bone. So they create kind of like a hammock or support system to help support all our organs, and which is one of the functions of our pelvic floor. And they're made up of, the whole pelvic floor is made up of a collection of ligaments, tendons, nerves, muscle. So they have a big role in, thank you, Samantha. Okay, so I'm just going to go back one slide, and so I'm just showing the pelvic floor. So that was the last slide that you missed. And just showing how the pelvic floor extends from the tailbone between the 2 sit bones, your pubic bone, and helps provide that support or hammock for all our organs. So now that goes into what are the functions of our pelvic floor. So our pelvic floor has a couple different functions. Well, not a couple, 5 different functions, or main functions. One is that support or that hammock. So you can see it in this photo here, the pelvic organs, and then the hammock is depicting the muscles, ligaments, and tendons, helping to support everything. Keep in mind too, this goes for any gender, whether you're male, female, transgender, anyone that is a human being or a living creature has a pelvic floor. The next function of the pelvic floor is your sphincter. So sphincter is not just the anal sphincter, but the urinary sphincter. So it helps control the passage of urine and feces. Next is sexual function. So that is a really important function, not just for pleasure, but also for pelvic health. The sump pump, which is another way to describe, it helps to pump blood back to your heart. So it works with your diaphragm. Your pelvic floor and diaphragm work really well together. Actually, another name for your pelvic floor is your pelvic diaphragm. Did anyone know that? Cool, eh? So it helps to pump blood back to your heart. So if you're having circulatory issues, it can be even helpful. Doing some pelvic floor exercises can be helpful for that. And then it's really important for stability. So the stability of our deep core, so our deep core muscles are what provide that deep stability. So it's less of those big muscle groups that allow us to twist and rotate. Those would not be your deep core. The deep core muscles are muscles that keep you stable when you're static. So if you're throwing a ball so you don't hurt your back, your pelvic floor engages, along with 4 other muscle groups called your transverse abdominis, diaphragm, multifidus, which are multifidus are muscles in your spine here. Your transverse abdominis are abdominal muscles, your diaphragm, and then your pelvic floor. So I made it like a sphere because they function like a sphere. So when one part of that sphere isn't working optimally, for example, if your pelvic floor isn't supporting you well, then if you have a cough or something and there's extra pressure, you could have incontinence or some leakage, or maybe a hernia in the abdominal cavity. So if we're someone that has maybe a respiratory issue and you're coughing a lot, that could cause a hernia. Back pain is another thing that could be linked to it. So that's telling me there's something going on in that canister that's not working optimally when something in that area is not functioning properly. So basically all the functions could lead to dysfunction. So if you have an issue with any of those muscle groups, it could lead to a loss of support of that hammock. It could be leading to urinary bladder incontinence, bowel incontinence, could lead to pain during sex, could lead to swelling issues, lymphatic drainage issues, and stability. You might not be able to stabilize properly through their balance issues, that kind of thing. So pelvic floor is very important. Have I convinced you all? I would say it's one of the most important. Maybe I'm biased, but I think it's so important for your daily function in every aspect of your life. Okay, so let's learn how to activate our pelvic floor. So activation of our pelvic floor, another word for it maybe you've heard before is the Kegel. Has anyone heard the Kegel? The famous Kegel. Do you know how to do a Kegel, or have you done a Kegel before? Yeah? Okay. So one thing I want to preface this all with is sometimes Kegels are not what everyone should be doing. If you do a Kegel and then you feel like you can't relax it, then it's something that would need to be addressed with a pelvic floor physio. You can go speak to a physiotherapist about your ability to relax those muscles, because just like every muscle in your body, for example, if I do a bicep curl, I want to be able to shorten that muscle fiber, but I also want to be able to lengthen it with control. So it's the same thing with your pelvic floor. If you're doing a Kegel and then you can't let the Kegel go and it's stuck like this, you're not going to get very far with your weightlifting, are you? So really important that everyone feels that release with their pelvic floor. Otherwise, let me know, and then I can tell you what, maybe you can go speak to a pelvic physio. So another thing is some people might not actually feel their pelvic floor muscles engage. So that can be normal as you are learning awareness of your pelvic region, and maybe you haven't done one before. So it does take some practice too. So we're going to do it together, and we're going to do it more when we do our exercise class too. So I'm just going to give you a brief overview of how to do a Kegel. So there's a couple different cues you can think of. You can imagine like you're picking up a blueberry through your vagina, you're squeezing it and lifting it up towards your head. Or you can imagine like a jellyfish swimming through the water, squeeze and lift up towards the head. Or an arcade claw here. So the arcade claw comes down, it grabs the toy and lifts up. So the motion that the pelvic floor does is a squeeze of the muscles, and then the last little bit is a lift up. If you don't feel the lift, that's something you can work on, because a lot of people will feel the squeeze but not the lift, and that might have to do with a strength issue that you can work on. So we want everyone to be sitting in nice, good posture, sitting upright. And we're going to, whatever cue worked for you, whether it was the jellyfish, the blueberry, picking up the blueberry, squeezing and lifting, or maybe it's that arcade claw. We're going to try squeeze and lift of pelvic floor, and then let it go. Squeeze and lift pelvic floor, and then let it go. Now, the couple things I saw some people doing that wasn't proper is your whole body shouldn't move when you do a pelvic floor contraction. So the only thing that should be engaging is those muscles in your pelvic floor. Another cue would be if you're going on the toilet, don't do this all the time, but it's this same engagement. If you're peeing and you stop the stream of urine, that would be a Kegel too. So let's try it again, but I don't want anyone moving their pelvis. I don't want anyone using their bum muscles or their inner thighs. We're going to do a squeeze and lift of pelvic floor, and then let it go. Good job. Squeeze and lift, and then let it go. Did everyone feel the let go of it too? Perfect. Did everyone feel their Kegel? Good. So we'll do that, and we'll do this some more exercises for pelvic floor afterwards. But that's kind of the little overview of how you do a Kegel. And then this photo just shows the direction that your pelvic floor. So here we have the pelvic floor muscles, and then as you contract, you get that lift of pelvic floor up and forward. Okay, time for another exercise. So we engaged our pelvic floor, but remember I had talked about that canister, and there's diaphragm on the top and your pelvic floor on the bottom? There's a big relationship with these two. And in order for everything to work really, really well together, a great exercise is your core breathing exercise. So we're going to be working on core breathing. Now, core breathing incorporates your breath work with your pelvic floor, which can be super, super important for that pressure management. So avoiding incontinence, avoiding prolapse, those kinds of things, okay? So we're going to start with not the Kegel, but just the breath. We're going to take our hands and put them on the sides of our rib cage. And we're going to take a nice deep breath, kind of like a yoga breath, breathing into our belly. And then exhale. As we inhale, I want you to try to breathe into your hands. Nice deep breath downwards instead of with your chest. Now, as you inhale, did you feel how rib cage expanded and moved to the side? So when that happens, our pelvic floor, or when our diaphragm contracts, it expands and pushes down in order for our lungs to fill with air. And in order for our organs not to get squished, our pelvic floor needs to relax. And we remember with a Kegel, up is contraction. So if you're having a hard job relaxing your pelvic floor, by doing belly breathing or diaphragm breathing, it helps to relax your pelvic floor. Does that make sense? So now we're going to put these two new things we put together in one exercise. So as we inhale, we're going to put our hands on our rib cage. We're going to breathe into our hands, relax our pelvic floor. But then on the exhale, I want you to do a little Kegel. So you're going to squeeze your pelvic floor as you exhale and breathe out. So inhale, breathe into ribs. Exhale, we do that little Kegel. Let's try that again. Inhale, relax your pelvic floor. And exhale, we do a little Kegel. Inhale, relax. Exhale, Kegel. Everyone kind of get that? We're going to practice it again afterwards too. So The reason why we do that is because it's really good for people that maybe it can be good for pelvic pain patients, people that have tightness in their pelvic floor, but it can also be good for patients who don't have the strength. So it works just like a bicep curl. You're moving up and down. With pelvic floor, you're moving up and down. So that's why I said just doing a bunch of Kegels isn't helpful. We need to be able to relax it too, and you can use your diaphragm to help with that. Does that make sense for everyone? Lots of info, I know. Okay, so some myths I want to go over. These are common myths that people don't realize about our pelvis. So one of them is pain during sex at any age is normal. It's never normal to have pain during sex at any point, no matter your age. So if you do, it's something that's totally treatable through pelvic floor physio, or there's other means too, but generally the gynecologist or urologist or whoever you're talking, I guess you'd be seeing gynecologists, would refer you to pelvic floor physio for that. Next is extremely painful periods. When I know most of you probably aren't having a period now, but if you've had it in the past, lucky you guys. But any type of extreme pain during your period is not normal. A little bit of cramping is normal, but extreme pain where it's debilitating and affecting your life is not normal. So it would be something that could be helped with pelvic floor physio, but also medically as well, and talking to a physician would be helpful. So if you have any grandchildren or any family members that have that, that could be a reason that you let them know that that's not a normal thing, that they should be going to see a physician about that. Only women need pelvic health physio. Not true. So lots of men need it too. There's lots of different reasons why you could need it. It's definitely more common amongst women because a lot of us, well, one of the reasons is we give birth sometimes, and then another reason is you have 2 holes there instead of 1. So there's more chance of things not working as optimally. And then our tissue is just a little bit more mobile than a lot of men too, so we are a little more prone to pelvic stuff. But in saying that, there's lots and lots of men that need pelvic floor physio. That could be maybe they have erectile dysfunction, maybe post-prostate cancer, maybe they're having incontinence, maybe they're having pain with intercourse. So there's lots of reasons why men could also have it. Maybe they're having back pain. So yeah, it's not only amongst women. And in saying that too, also transgender as well. And then only women need, already said that. Normal to have leakage after childbirth or as we age. It's never normal to have any urine leakage. It's something that can be addressed by pelvic floor physio. It's definitely common as we age, and I'll go into the stats later, but it's something that can be addressed and should be addressed because it can help decrease chances of urinary tract infections, which we'll go into the stats of why that's also really important, which maybe you have heard of too with hospitalizations at the hospital because of urinary tract infections. And then Kegels treat all urinary incontinence. So Kegels treat all urinary incontinence. So like I said, Kegels can be helpful for incontinence, but if your issue is the muscles are too tight and you need to relax those muscles, then it might not be the best option for you. Or maybe there's another reason you're having the incontinence that needs to be addressed medically too. So Kegels aren't always the quick fix to everything. And there's also different types of Kegels that you can do, which we're going to do in our exercise class today. So why is pelvic health important as we age? One is low back pain. It can help. I would definitely say if you have low back pain, go see a pelvic health physio because they can really help with that. Urinary or fecal incontinence, if you're having any of that, that would be a reason to see a pelvic health physio. Pelvic organ prolapse, so that is a good reason to see a physio too, or pelvic health specifically physio. In saying that, depending, no matter what, no matter the stage of your prolapse, it can still be helpful to see a pelvic health physio. But sometimes when it's more severe prolapse, then you need other interventions too. So I'm not saying it's going to fix every prolapse, but it will definitely help with certain types. Painful sex, which we talked about, pelvic floor physio will help with that. And helping to prevent urinary catheterization, which is going to be really important as we get going with this slideshow, because I'm going to go into some stats of why getting urinary catheterization, although necessary sometimes, can also be avoided if you do certain, if you see a pelvic health physio or manage your symptoms beforehand to make that never the case for you, or hopefully decrease the chances of that happening. But in saying that, it's not all on you too. I've read in the literature that medically they are using catheters too much sometimes. Nurses will, not just nurses, doctors, but it's just easier in the hospital when they're seeing so many people. So it's not all on you, but you can avoid having to get to that point or you can help yourself avoid to get to that point to some degree, sometimes by doing some physio. Okay, and then this is just some other reasons why you might see a pelvic health physio. So if you're looking for an inclusive or trauma-informed care, if you feel abdominal pain, or you've had abdominal surgeries, if you've had a hysterectomy or a prostatectomy, if you're having lots of constipation, and of course prenatal, postpartum is also a good reason to see a pelvic health physio. And if you've been diagnosed with endometriosis or PCOS or painful bladder syndrome or interstitial cystitis, those would be reasons that you can see a pelvic health physio. Or also having an enlarged prostate as well. Now for some stats. So 25 women and my percentage didn't show up there. I don't know why. Anyways, 25, that's a percentage there. So 25% of women and 11% of men experience urinary incontinence globally of any age group, okay? So it is pretty high. But then as we get older, I don't know why, none of my percentages showed up for some reason. Weird. I wrote them in. 50% of postmenopausal women experience urinary incontinence. So as we get older, it does increase significantly, because on that last slide we saw 25 and now we're seeing 50 after menopause. And there's a couple reasons for that. One is, well, a big one is estrogen levels drop after menopause. So you have more vaginal dryness, more vaginal atrophy, which is the muscles not as strong or as plump. And then inactivity is a big one too. And then one study showed 22% of men post-prostatectomy, so after they have had their prostate removed, have urinary incontinence. So your chances of developing prostate cancer increase as we get older. So this goes with aging too. So you can see the increase in men as well as they age in having urinary incontinence. Now, this is a cool, interesting thing you can all remember. The normal amount of time to go pee per day is around 6 to 8 times per day. So you can count how much you're going pee per day and see if you're kind of in the norm. And the normal amount to go at night is, if you're over 50, is 1 time at night only. If you're going more than that, it's a couple reasons. Could be your medication, for sure. High blood pressure medication is definitely going to make you go pee more. But there could be other reasons too, and if you're not really sure why you're going so much, it would be a good reason to, or a good thing to bring up to your physician of why, and asking that question of why you're going so much. And then for bowel movements, normal bowel movements, there's a big range, so it's anywhere between 1 to 3 times per day having a bowel movement, or every 3 days. So huge range, but if it's over that 3, then it's considered constipation. And if it's under that, then, I mean, probably a medical reason why you're going more and more often, or medication too. Certain medications are going to give you the runs a little bit too. But definitely something you could bring up to the doctor to help control that, Metamucil, those kinds of things. But always check with your physician first. Don't just do it. Okay, and then sexual pain. So 17 to 20% of women will experience pain with any type of sexual act, and then 2 to 10% of men. So it just shows that, yes, it's definitely more common in women, but it's still not only in women as well. And 41 to 50% of women 40 and over or menopausal will experience a pelvic organ prolapse, which is crazy how high it is. I was shocked at how high it was. And I mean, a big part, women are definitely more prone to prolapse than men. Men can also have prolapse, but only of their rectum, whereas women, we have 3 things that could prolapse. Your cystocele, so your bladder, could be your uterus, or it could be rectum, so all 3. Part of the reason why it's more common in women is 1, childbirth is a big one, and 2, we've got those 2 holes, so pressure, if pressure is not regulated properly in that canister I talked about, so like doing those breathing exercises I talked about will help regulate pressure, but bearing down and holding your breath and pushing when you're on the toilet are all going to be things that are going to put more pressure on there and will make increased chances of the support not being as supportive. And then men, on the other hand, we tend to have more prolapse. Men will have hernias, which you've probably heard a lot of men having some inguinal hernias into here. So a prolapse, all a prolapse is a hernia. It's just a hernia of your vaginal canal. So it's just something pushing into that vaginal canal. And on men, it's they have inguinal hernias where there's a part pushing into this area. So we both have them, and both of them are going to be treated in part by pelvic health physio. Okay, going into urinary tract infections, because I think this is a really important topic, because ooh, there's a big line through it. There is urinary tract infections. There's 25% of geriatric hospitalizations are due to urinary tract infections, which is so crazy how high it is. It's the 3rd leading cause of hospitalizations from any other cause. And luckily, not luckily, but I mean, not as many people pass away from it. But if you keep going and going, and we know that every time someone goes to the hospital, it's not the best thing, right? So we want to decrease those chances of going to the hospital for unnecessary reasons. And one of those would be to prevent things like needing to get a catheter in the first place. And urinary catheters are the main reason why people have UTIs, urinary tract infections, and it's keeping that catheter in there for a long time and bacteria building up. So if we can prevent that step completely, then we can prevent those UTIs from occurring in the first place. But also there's other reasons why you could have a UTI, which I'm going to go into, some other reasons.
Oh, sorry. There you go.
And some other reasons would be urinary retention. So you're not able to empty, or you're not feeling if you're emptying properly. And one reason for that could be the muscles are too tight and they're not relaxing to allow you to pee. There's other reasons too, neurological reasons as well, but I won't get into all of the reasons. Urinary incontinence, so having bladder leakage could be a big one. So if you're having a lot of leakage and not changing your pad, so hygiene also would be a big reason for having a urinary tract infection. And then poor use of your hands, so if we're not able to functionally wipe ourselves properly or get to the bathroom in time, or having any like physical limitations could cause urinary or could lead to some urinary catheterization or infections. And then other reasons again would be constipation, having chronic constipation and not going to the bathroom enough, vaginal atrophy. So I talked about the tightness in pelvic floor. So if we have vaginal atrophy, which is the muscles not being as plump and lubricated, then we're not clearing out any infections either. Enlarged prostate could lead to urinary infections too, so having to pee all the time. So men, when their prostate gets larger, it can cause more frequency to go to the bathroom more. And then I had mentioned already, hygiene is a big one. So all of these things can be helped with pelvic floor physio and through treatments, but also education on proper hygiene too. So, goes into my next slide pretty much. So how can we help? Well, I'd mentioned the incontinence. We can help with incontinence. We can help with retention. We can help with pain during sex. We can help with prolapse, hysterectomy, menopause symptoms, any dryness or atrophy of the muscle, chronic constipation, and bedwetting.
I have a question.
Yeah.
When you were saying about the causes, can medications cause it as well?
Medications?
Yeah.
Yeah, definitely. Yeah.
Yeah.
Totally.
Something in one of the medications I'm on makes you pee out for sugars.
Yeah.
So a lot more sugars down there.
Yeah, 100%. Yeah, medications definitely are a big reason for UTIs too, because it changes your pH in there too. So definitely something to bring up to your doctor if you're having frequent UTIs. I would definitely not just ignore it, and definitely bring it up, because maybe there's something they can adjust in your medication or. So,
I've only had two, like in the last 5 years.
okay, yeah.
I'm pretty sure it's from the medication.
Yeah, definitely. There certain, and then there's also, which one? I know some high blood pressure medication too. Well, just because you're peeing so much too. Yeah, for sure. And antidepressants too could, because your sexual drive's down. That could lead to inactivity of pelvic floor, that kind of thing. Yeah.
I'm single.
But you can still do stuff. You don't need a partner. And what would consist, so this is what's gonna, like when you see a pelvic health physio, what could happen in a pelvic health appointment. Observing the person, we'll check your posture, we'll check how you're standing, we'll check your movements, how you're breathing. We'll check your spine, do a whole spine assessment. We'll check all those deep core muscles that I talked about. We are also trained to do an internal exam. So some of you might not know that, but pelvic health physiotherapists are trained to do internal assessments, and it's the gold standard for assessing that area. Of course, if you don't want to do an internal, there's other ways that we can try and get certain information. Just you'll get a little bit more information if we do the internal exam. And then we will also determine from all that assessment what treatment would be best for you, whether it's coming to pelvic health physio or referring out to see a specialist or to go back to your doctor to address any medication stuff. All of that, we can help direct you which way to go. Okay, so now I'm going into the physio for some specific things that might pertain or be of interest to you. So physiotherapy for prolapse. So there's different things we can do. One big thing is pressure management, because you can imagine anytime you're putting pressure down there, what's going to happen. Does everyone know what a prolapse is?
Yes, I know.
No?
Things drop down.
Yeah, so prolapse, basically, here's a kind of a photo of it. You can think of that hammock again. So we have no prolapse. The hammock is supporting all of your organs. So your bladder is being supported, your uterus is being supported, your rectum is being supported. A cystocele is when your bladder is not being supported, so it could cause a bulge of your bladder into the vagina, and if it's more progressed, it could actually protrude outwards. And then a rectocele would be the same thing, but of the rectum, and then a uterine prolapse would be the same thing, but of your uterus. You could have all of them, you could have one of them, you could have none of them. But that would be something that Pelvic Health Physiotherapist could check to see if you have one. And then we would refer to the doctor or physician for if we think that other interventions are needed as well. So toileting is really, really important. So we want to make sure we're not pushing when we're on the toilet. So we think of our breathing exercise where we breathe into our belly. So that helps to relax our pelvic floor rather than bearing down and pushing. Trying to avoid blowing our nose too much when you're on the toilet too. That puts more pressure on your pelvic floor when it's in a vulnerable position because you're more relaxed. Your pelvic floor is more relaxed when you're sitting on the toilet. Has anyone used a squatty potty or a little stool to put under their feet? Yeah? Some of you? Yeah? So squatty potties are awesome. Maybe I'll use a little bucket. I'm just going to can I grab this bucket? Yeah. So a squatty potty is you literally just use a little stool, something that was handy having that stool right there, or that bucket. So when you use a squatty potty, what it's used for is when you're having a bowel movement if you're pooping. So you want your knees to be above your hip height. So your feet should be, and they should be probably a little wider apart too. But this provides a favorable angle for your rectum. So it changes it so that your rectum, that's normally about a 100-degree angle, becomes straight. So then stool can just fall straight out. And then you don't have to push as much. So I encourage everyone to get a squatty potty. That will help, even if you don't have a prolapse.
What about because I have a toilet, a high-end toilet, and that's different from the ones outside, because it's a high toilet, you're up higher. Does that make a difference?
Is yours higher or lower?
Mine's higher.
Yeah, so I would definitely, because then you're going to be even less at that angle.
Yeah.
Mm-hmm. Definitely. Yeah. And anyone, whether you have a prolapse or not, this is just a good way to prevent or helping to, you might not be able to always prevent it from happening. There's other factors that affect it. But this could help make prolapse symptoms less severe or could help kind of keep where it is at instead of always bearing down and pushing when you're on the toilet. And it will make make you have a nicer bowel movement. So the stool is a great one, breathing, and then getting into positions. If you're finding you're having a lot of pressure and heaviness, maybe you've gone for a long walk, and by the end of the day, you're feeling that vaginal pressure or feeling like something's going to fall out. If anyone has prolapse here, you know what I'm talking about. Putting your feet up on a chair or putting a cushion underneath your pelvis or putting your feet up on the wall can all be really helpful positions to help avoid that feeling of pressure and heaviness and can take some of that pressure away.
Yeah, but then we need all the exercises, how to get up.
Yeah, right? Then you do my fall prevention class. But you could do it on the bed, right? Just put some pillows underneath there, like something underneath your pelvis there. And if there's any reason that you have a lot of dizziness being upside down, I would definitely double check with your physician before going into any of these kinds of positions, okay? And then other things that could be helpful, some of you might not get into that position, but doing certain stretches can be helpful. Like another good stretch would be just like a glute stretch. You put one leg over top and lean forward. Put your legs apart and lean forward. Doing some adductor stretches or hamstring stretches will be great for that. And then bridges. So stretching's great, but you really need to get that strength. So going for walks, getting some exercise is going to better support that, because if you have more support of everything underneath, then it's going to better support, even if your pelvic floor is weaker, which you also want to work on that as well if it is weaker. But if you can add some more strength to maybe your bum or your hips, then that can better support your pelvic floor too, or the organs in your pelvic floor. Okay, so now physiotherapy for pelvic pain. There's a couple different well, there's lots of reasons why you could have pain, pelvic pain. One of them is a big one, would be endometriosis would be a big one. Painful bladder syndrome, PCOS. Certain medications, high blood pressure medication, antidepressants, which I had talked about. Sexual trauma would be one. Surgeries, abdominal, pelvic, hysterectomy, prostatectomy. Menopause is a big one, so that drop in estrogen that I talked about. And then sexual inactivity, not having sex as much too, or not engaging in any self-pleasure too, could also could lead to pain. Not always, but could. And then possible treatments. We're going to go, there's a nice group of photos, but this is just the list of it. I'm going to go on to the next slide because it's more boring to read a list. And photos are way better, right? Okay, so lots of things we can do in pelvic health to help with pelvic pain. One big one is there's some massage techniques of your pelvic floor because those muscles are muscles just like any other muscle in your body. So certain techniques to massage your pelvic floor can help decrease the tightness of those muscles. So a pelvic health physio would show you how to do the massage. And then there's different tools. For example, sometimes getting in those positions are a little difficult. So there's this kind of tool. It's like a wand, and it's tilted in, and it can help give you some leverage so that you don't have to be in a contorted position to get into it. This thing here is called an O-nut, and O-nuts are devices that if your partner was a male, you could put the O-nut on. If you had pain with deeper insertion of penis, then it would help decrease that barrier or make that barrier less. So then you could take each of these little rings off as pain goes away and go a little bit deeper each time. So it's a way of still being able to have intercourse, but more gradually. But in doing all this, I wouldn't go out and buy these until you talk to a pelvic health physio, okay? And then these stretches are great. So any like hip stretches, glute stretches, hamstring stretches, back stretches, those are all going to be really great for decreasing tightness in your pelvic floor. And I want to just note too, a lot of people will think as we age, things are not as, there's a misconception that everything's not as, is a little looser. It's actually opposite after menopause because that tightness, right? So you have less estrogen. So, I mean, not always, but sometimes there's actually more tightness. So your in your life, a lot of the time what happens is if you're more active and you're younger, you're more on the, not always, but sometimes you're more on the tighter side. And then you give birth, and then sometimes things are a little less tight. And then you do menopause, go through menopause, and then it's back to the tight side. So you go through life in different phases, so don't assume that what everyone has in their head of, it's a misconception to think that way. And then breathing. So the breathing is really, really important, less with the Kegels when we have tightness. We eventually probably will do some Kegels, but we would first do more of just that rib cage breathing. Breathing into our rib cage, belly breathing, that kind of thing, because we know that that stretches our pelvic floor. And now urinary incontinence, so physio can help with that too. So depending on the reason why you have the incontinence, so this is why it's so important to note that it's not always Kegels that are gonna fix everything. So some possible reasons you could have incontinence, it could be, what if the muscles, well, maybe it is the muscles aren't strong enough. If they aren't strong enough, then you'd want to be doing some Kegels. But if, for example, your muscles are strong, but they can't hold a contraction very long, so the endurance of them isn't as great, then we would want to be doing Kegels to work your endurance, which we'll go over in our class today when we do some exercises. Timing of the contraction. So maybe you're, like this is more a lot of the time with, well, not just with athletes, but a lot of the time with athletes, actually 80% of elite trampolinists have incontinence. So a lot, and it's actually 3 times more likely to have incontinence in high-level athletes than a sedentary person. So it's not always as we get older and all that. There's other reasons these people are having it, and some of it would be the timing of the contraction. Maybe they're jumping on a trampoline, they have tightness of their pelvic floor, and their pelvic floor can't contract quick enough to provide that support when they hit the trampoline, and then they have leakage. The speed of contraction, it also goes with that. And then bladder habits too are a big one. So like maybe you're holding it for a long period of time, or maybe you're going too often. So we can help train that using a bladder diary, and then we can help see why are the reasons you might be having some bladder leakage. And then other treatments would be different pelvic floor exercises, abdominal exercises, different lower body strengthening exercises, and stretching, and Pilates are great too, yoga's great, all that kind of thing. Oh, and that's my clinic, all of us. We did a funny video, but the video is not on here, but it's, if anyone has access to Facebook or Instagram, it's on our account, you can watch it. And then here is just some free resources. So this is some information about prolapse, so you can follow that link if you want to read a little bit more, or not read, listen more about prolapse. Pelvic tension or pain, there's some links for that. And then core breathing. So core breathing is that exercise the breathing inhale, relax pelvic floor, exhale, and contract. And then my long list of references. And then there's my contact info. And if anyone has Instagram, you can just scan that, and you can, there's a bunch of information on our Instagram page too. And that's it. Any questions? Yeah.
Well, when I did home care,
Yeah.
IUD was quite common. We thought it was because the back and the front were mixing. Maybe that's a misconception.
The UTI, right?
Yeah,
UTI.
sorry, the UTI.
Yeah.
Yeah, the back and the front was getting mixed up somehow. And because these were not people in the hospital, these were people at home.
Mm-hmm.
And hadn't gone to the hospital, and were getting reoccurrence of it. So we wondered how. That's what we blamed it on.
I mean, definitely that could be a reason too, because that goes with hygiene too.
Yeah.
So you want to be wiping normally like front to back, not back to front, right? But then also like not like making, if you are using pads, to change your pads more often. Don't be using panty liners. I would opt for changing your panties more than using panty liners, because panty liners keep bacteria in there. They're not really absorbent like a pad for bladder, for urine. So yeah, definitely, that would definitely be a reason for it too. Yeah.
I'm trying to figure out why it was gone, because we had more than one person with it. It was quite constant kind of thing.
Yeah.
And I said, well, why, but this is explains more about it.
Yeah, totally. Yeah, there's so many reasons why. I mean, then there's things out of our control. If you have MS, or if you have a neurological disease of some type, maybe you won't have that feeling. If you've had a stroke, if you had a spinal cord injury, then you just can't, doesn't matter how much physio you do. I mean, to some degree it might help a little bit, but sometimes there needs to be other interventions or other care medically. Then physio is not always the fix for everything. Yeah. Yeah. Yeah.
Here it said sometimes that drinking cranberry juice can help ward off the UTI. Is there any truth to that?
Yeah. From what I've read, it's I think it has to be pure. I mean, I'm not the one to comment on this really, because I'm not a pharmacist or a physician, but when I've had my own UTIs in the past and gone to the pharmacist has told me in the past that it's kind of not true. Once you have the UTI and you drink cranberry juice, this is what he told me, so don't quote me on it, but that it doesn't, like once you have it, you need to take the medication for it.
More of a prevention
But
than not a treatment.
he said you could, if you take the pure cranberry juice, not the sugary stuff, because the sugary stuff could cause more UTIs too. So it could defeat the purpose, but you want the stuff that doesn't taste so good. Yeah. But check with the pharmacist, because that wouldn't be my area of expertise.
What kind of exercise would you suggest? You're just sitting there watching TV or just sitting there, whatever, and just as a regular basis, what would you do
Yeah.
for exercise that way?
Yeah, well, I guess it depends on, one, what your like physio goals are, like what you would want as your goal of doing the exercise. But I always think a safe bet is that core breathing exercise, because you're relaxing the muscles and you're contracting them. So if you have pelvic tension, like that tightness, you're focusing on relaxing too. So as long as you actually feel it relax, that one would be a safe one to do, because it works on breathing and it works on pelvic floor. So I do love that core breathing exercise. That's why in the links, this guy right here, I love that one, because it's generally like most people don't react to that in a negative way. But the ones that could react in a negative way with that one is if you are Kegling, but you can't relax the muscles. But that would be a good one. If those people weren't able to relax, then I would just get them to do like diaphragm breathing. Yeah. Yeah. Yeah.
When doing Kegels, is there a recommended time you should hold it before you relax?
That again also depends on like what your goals are or why you're doing the Kegels too. So it'd be something that you would have to like go to a physio or a pelvic physio, and they would have to tell you like what your specific recommendation would be for exercise. So I guess it's kind of like if you're coming in and someone wants some bum or glute exercises or some leg exercises, well, you need to assess the person before you know like what is the best thing for them. But there's certain numbers that we're going to do in our class that we want to try to aim to get at. So this might give you a good idea of like where you're at for pelvic floor wise. And then if you find you're not able to do the stuff that I'm doing with you, then that would be your exercise. Does that make sense? So we'll do a kind of a giant group assessment of everyone. And then you have to take note in your head, because I can't keep track of everyone, of what one you found was really, really difficult. And if you found it difficult, then it's something you could practice at home. Yeah. Okay? Yay.
Any other questions?
Yeah.
So a few years ago, I have breathing problems.
Yeah.
And I was going through something and couldn't stop coughing. I just coughed constantly.
Uh-huh.
If somebody made me laugh, I'd start coughing.
Ugh.
Couldn't stop. I noticed after a while, I'd cough and
Have leakage, right?
Yeah. And that went on for quite a while.
Mm-hmm.
And then I started doing the Kegel exercise.
Mm-hmm.
Now, they improved it, but when the coughing stopped, it went away.
Yeah. Yeah.
But coughing can actually cause that?
Yeah, if you're like putting so much pressure for such a long time and your muscles don't have maybe they have the initial support, but then they're just so tired because you're just coughing all the time. So then, yeah, totally, that's super.
I couldn't even feel it though.
Yeah.
Because I was just coughing that bad.
Yeah.
But I would cough constantly.
Yeah.
For an hour.
Yeah.
Stop.
It's because your muscles were just so fatigued and tired from all that pressure for so long from coughing. So thank God it's got done. But what you can all do, if you ever cough or are in a coughing fit or a sneezing fit or blowing nose fit, I don't know. I'm not really in a blowing nose fit. But what you can do is practice, do a Kegel and hold that Kegel while you're coughing. So you hold it to prevent that extra pressure on there every time. And then you release it after you have your cough. So if we were all to cough, I would hold that Kegel while I cough, and then you relax the muscles. So I would start maybe practicing that to prevent that from becoming a thing.
There was none of that.
No.
I would cough and I would just go into this.
Yeah.
Constant.
But honestly, like, when you're coughing that much, probably most people would have some leakage because that's not like a regular normal thing to be.
And I was at the doctor's office all the time.
Yeah.
I couldn't figure out what was wrong with me.
And you got it all figured out now, though, eh?
Yeah, I had an allergy to something.
Huh. Interesting.
Yeah, something you're not supposed to be allergic to.
Wow. Crazy. Yeah, not fun. I hate coughing. It's the worst. I always cough, like, because I wear my mask at work and stuff. And I think because I'm talking so much and then breathing in the same air all the time, my throat gets so dry. And during COVID, I'd be coughing, like, so much. And everyone would be like, and I'm like, it's not COVID. I'm like, it's just from this mask and the dry air, and I don't even know.
If you have asthma or any breathing problems and you're wearing a mask, that happens.
Yeah, I think I have some asthma too. So I think it didn't help.
And I still have a cough, but not like it was.
Thank God.
Yeah.
Oh, terrible. And then you try to hide the cough and you try to suppress it, and then you're like,
No hiding.
and then you're just nothing you can do.
I went in for a test in the hospital.
Yeah.
And between her and the nurse, they decided this lady can't laugh because somebody could tell a joke and I'd laugh and and the nurse came out and she said, I just want everybody, when the waiting room got full, don't anybody crack any jokes.
That probably made you laugh, didn't it?
It did. I started coughing and
Oh, that's terrible.
I ended up in an ultrasound, and I don't know how I stopped laughing for the time, or coughing for the time I was in there.
Oh,
And it
God.
stopped, and
Oh, my God.
started up as soon as they pulled me out, but yeah.
Oh, my God. Not fun.
Okay, if there's no more questions, I think we'll maybe take a quick couple-minute break and then we'll do our exercises.
Yeah.